I'm Dr. Jeremy Gebhart. I'm a board-certified, fellowship-trained orthopedic surgeon who specializes in hip and knee replacements and revision hip and knee replacements. Throughout medical school, shadowing different physicians, when I worked with the orthopedic surgeons, the patients seemed to recover very quickly, be very satisfied, especially with hip and knee replacements. I quickly learned that hip and knee replacement are two of the most successful, highest patient satisfaction surgeries in all of medicine, and they can have debilitating pain. They come back even a week or two after surgery and they're doing great. So it can really be a life-changing profession. So the patients that I see are generally grouped into about 3 different categories. The first are people who are just having recent onset hip and knee pain. Oftentimes if they do have arthritis or degenerative joint disease, we'll start with things like physical therapy. We can do things like cortisone injections. There's different medications we can try. When those things fail, oftentimes that's when I first meet the patients. They're referred to me by their primary care doctors or a non-operative surgeon or non-operative physician. At that time, we discuss total joint replacement. That's total hips, total knees, partial knee replacements. And the final group of patients I see are people who've had a total joint replacement, either a hip or knee replacement, either a long time ago and it may be wearing out, coming loose, have an infection, things like that. Or maybe they've had a joint replacement and they just aren't happy with it. So we have an algorithm that we work through to try to figure out exactly what's going on. And in many cases that involves revision replacement. State of hip and knee replacement, the patients are doing extremely well even compared to 5 or 10 years ago. Some exciting advancements we've had recently are the popularity of anterior hip replacement, and that's something we offer. Patients are recovering more quickly, generally happier with their hip replacements. On the knee side, we're using robotics assisted surgery. So that's the newest, latest, and greatest thing. Our hip and knee replacement are 2 of the most successful, highest patient satisfaction surgeries in all of medicine. The goals of surgery are to alleviate pain, get you back to doing what you want to do pain-free. The most common thing I hear, even again a week or 2 after surgery, is that, oh geez, I waited too long, so I should have had this done 2 or 3 years ago. So patients do extremely well. It can really be a life-changing surgery. So I grew up in Western Pennsylvania. I always wanted to come back home and treat the people that I grew up around. I've seen neighbors and family members that I've operated on. And I'm currently residing in Meadville. It's great to see patients and co-workers throughout the community. Makes it extra special.